Hello students, we will discuss a surgical procedure which is very commonly done as an emergency often and many times as an elective, especially in general surgical unit. So what is that? So what this done surgical procedure was? So see that what is this? See that you can see the knee joint here. You can see here. So this is below knee amputation with the stump, of course, with a posterior flap. So which is very commonly done surgical procedure for critical limb ischemia, gangrene, especially in diabetic patient, atherosclerotic patient, elderly people, those who are smoker. So gangrene extending from the foot above, you can't save the foot, you have to do the below knee amputation. Further, many times it extends upper part, then you have to do above knee amputation. So very commonly done surgical procedure, remember, below knee amputation. So what are the features? It is commonly done for ischemic limb, I already told. Often for distal malignancies like commercial carcinoma, which is infiltrating, or sarcoma in the foot. So one joint above you have to do amputation. If it is wide local excision with the functional limb or limb saving procedure is not possible, stage wise or local infiltration wise, then you have to do amputation. It is called as a Burgess operation when it is done for ischemic limb, not in other procedures. Now flap here you have to remember is posterior flap. See that this is the posterior flap, unlike in above knee it's the equal flap. So it is posterior flap. Ideal stump here is 15 centimeter from the knee joint, minimum is 88 centimeter. So this is the 15 centimeter from the knee joint. So minimum stump required is 8 centimeter. Usual stump what we use is 15 centimeter. This is the MCQ question, remember. 10 to 15 definitely, minimum 8, not lesser than that. If lesser than that, if you do that stump is not good, you may not be able to put any prosthesis for that, and it will cause problem to the patient, may not be able to manage with the stump. So that is the point which you have to remember. Now remember, amputation is a very important topic both for UGs and PGs. Remember, especially in the leg, below from the ray amputation, lift frank, chopards, cymes, modified cymes, pyrogaps, below knee, transgenial gritty strokes, that is above knee, then hindquarter amputation. Those amputations also you have to remember. So for that you have to go through, you can go through my book in detail about amputation chapter. Go through my clinical surgery book, clinical methods in surgery book, current edition, which shows how to examine a patient with the peripheral vascular disease. There is a video also how to examine with all illustrations, photos, and explanations correctly how to examine a patient. That is also there. And we can go through my surgical manual book, and surgical current edition, which gives again details about the ideal stump, different level, diagrams in amputation chapter. Operative surgery also again gives a proper explanation of amputation, so one can read that and do the surgery, especially for postgraduates and young surgeons. And tissue approximation, suturing, gives an atlas of around 100 pages, and with the video how to do suturing, very useful for beginner. Of course, my DigiNow through JP Publisher gives a detailed explanation of the current CBME syllabus, which includes all chapters, CBME also. So students can always purchase and subscribe for 1 year, and you can have a very easy understanding of the surgery, both for exam, viva, and practicals and theory, and for knowledge purpose also. Student hope you people have understood this about below knee amputation in briefly. Thank you very much.